This video will discuss your pelvic health and provide advice on how to maintain the strength of your pelvic floor muscles. Your pelvic floor is a group of muscles at the base of your pelvis. These muscles help to keep your bladder, uterus, vagina and bowel in the right place and functioning normally. The muscles also play a role in sexual function. The pelvic floor muscles work hard during pregnancy, supporting your baby. Therefore, keeping these muscles active and strong is important regardless of how your baby is born. It is, however, particularly important if you have had a forceps or ventouse birth, an episiotomy or significant tear. Strengthening your pelvic floor will improve bladder and bowel control and prevent organ prolapse. The best way to exercise your pelvic floor muscles is through specific strengthening exercises called Kegels. These are when the pelvic floor muscles are actively contracted and relaxed. We will now discuss the two types of Kegel exercises, long-held and short-held squeezes. It is safe to exercise your pelvic floor even if you've had perineal stitches and feel a bit sore. However, if you've had a catheter inserted, this is the tube to drain urine from your bladder. Wait until it is removed and you are passing urine normally. To locate the right muscles, 1. Tighten the muscles around your bottom as if trying to stop wind from being passed and draw them up and forwards. 2. At the same time, tighten the muscles around your vagina and urethra as if trying to stop passing urine. 3. There should be a feeling of a lift and squeeze inside. At first, it may be difficult to feel your pelvic floor muscles working, as it can take some weeks to build the strength back up. Long-held squeezes. 1. Squeeze and lift your pelvic floor muscles as hard as possible. 2. Hold for a count of 10 seconds. 3. If your muscles feel too weak to hold for 10 seconds, aim to build up the time slowly. 4. Repeat this exercise 10 times, 3 times a day. Short, quick squeezes. 1. Tighten and lift your pelvic floor muscles as quickly and as strongly as possible, then relax. 2. Do this 10 times. Aim to do this exercise 3 times a day, every day. Performing these exercises regularly should help your muscles become stronger and more effective. If performing the exercises is difficult or painful, or they don't seem to be working after about 6 weeks, talk to your midwife, health visitor or GP. Finally, the NHS has a helpful app called Squeezy. The app was designed by physiotherapists who specialise in pelvic health and offers information and tips as well as video and audio guides to the exercises. The perineum is the area of skin between your vagina and your anus. It is common for the perineum to tear during vaginal births. Tears can also occur to the labia, inside the vagina, or near the anus. During the recovery period, it is important to maintain good hygiene. To reduce the risk of a wound infection, it is recommended that you wash or shower at least once a day, using only water to keep the area clean. Pat yourself dry with a clean towel, ideally that is only used by you. Change sanitary pads regularly and ensure good hand hygiene, washing hands both before and after going to the toilet or changing sanitary pads to avoid introducing bacteria to the wound. Generally, tears will fully heal within 4 to 6 weeks, and it is important that you maintain good hygiene throughout this period. Tears often start to feel less tender after just a few weeks. Please bear in mind, for those who have a 3rd or 4th degree tear, a tear which affects the anus, recovery is likely to take longer and a referral is made for follow-up appointments and specialist physiotherapy. It is normal to feel some pain or soreness following a tear, particularly when walking or sitting, though this should improve day by day. Painkillers, such as paracetamol, can help relieve discomfort and are safe to use even if you're breastfeeding. Sometimes, despite maintaining good hygiene, a tear can still become infected or not heal as well as we would expect. It is therefore important to let your community midwife or GP know if your stitches become painful, your stitches smell unpleasant, you feel like your stitches are not healing as expected, you experience flu-like symptoms including a fever, raised temperature, muscle pain or shivering, you experience any loss of control over your bladder or bowel, you feel pain during sexual intercourse once your tear has healed, or if you have any other concerns.